Hi, I'm Akita Bozeman. I'm here today at Rutgers pursuing my MPH with a concentration in health systems and policy.
Hi, my name is Shreya Patel. I'm doing my master's in public health, and my concentration is health systems and policy.
Hi, my name is Ahana.
Oh
I'm
my
doing
God.
master's in public health, concentration in global public health.
Hi, my name is Abinu Barmanias, and I'm doing a Master's of Science in Epidemiology with a concentration in pharmacoepidemiology.
Hi, I'm Azana Saul. I am in urban public health concentration. I'm getting my degree in Masters of Public Health, as well as a certificate in maternal and child health.
Hi, I'm Brianna Vo. I'm also doing my MPH, but I'm doing it in epidemiology, no certificate.
Hi, I'm Patricia Jean Baptiste, and my degree is Masters of Public Health, and my concentration is Social and Behavioral Health Sciences.
Hi, my name is Dawnette Jones. You can call me DJ. I am now in the Master's Program of Public Health at Rutgers University in New Brunswick. My concentration is Social and Behavioral Health Sciences.
I decided to pursue a degree in public health because I'm super passionate about healthcare, making sure that everyone has equitable and quality access to healthcare, and health is a human right. So I feel as though that everyone should have access to healthcare and be able to have these resources to make their life better.
I decided to do this path for public health because ever since I was in college, I knew I wanted to do something with patient care and something within health systems. So I was like, this is the way and like the path to go for that.
I decided to do my master's in public health because I wasn't really sure what I was looking for. When I signed up for it, I knew I wanted to do something in public health. I did my first master's in biology and concentration in neurobiology, and a lot of the themes that were coming up were public health related topics. So I just decided to dive right into it and see if it was something for me and how I like it and what I like, what I don't like. It was just something that I just went with my instinct, and here I am, and we'll see how it goes.
I majored in public health as an undergrad, and I actually work on the opposite side of this building, working with rats all day. And so I think it was very important to kind of take a step back from lab work and try to understand the situation that's currently happening in society with humans rather than in rodents. And so that's why I wanted to go on the opposite side of this building to understand how drug development affects the prevalence of ailments and illnesses.
I chose public health because I'm very interested in women's health in general. I love helping people in general, so I guess that's the public. I also live in Newark, New Jersey, and I just see like all the disparities that everyone faces on a daily basis, and some people don't have accessibility or affordability towards anything, or not many resources, so I felt like I need to make a change in that area.
And I chose public health because I think that getting my master's in public health would be like a good gateway to holistic medicine because I want to pursue medical school. And plus I'm from Cleveland, Ohio, so moving here and seeing the diversity and all the disparities really opened everything up.
I decided to pursue a career in public health because I've always been very interested in health sciences, and I feel like there was a calling to be in public health.
Funny enough, I started as a nursing major at my previous university, that's Caldwell, and within the process of doing it, I started to research more about public health, trying to encompass exactly what it means for people. And I noticed that there were a lot of people, specifically when it came to mental health, that they didn't understand that public health is really important where that is concerned, especially for minorities. So for me, as a minority myself, I noticed that there was a need for people to be more educated with the way how they can change their health behaviors. And I hope, after this degree is finished, that I'll be able to do that.
I hope that obviously I'll be graduating, moving on to a career in public health. I just want to tell my sister that you worked so hard for this. Only you know how much you put into it, and that you should be very proud of yourself, and that it's only up from here. And you should really just bask in this because it's everything that you ever wanted, and just take some time to really think about how grateful you are for how far you've come.
Wow, that was a lot. Watching that video, I'm trying not to cry. It made me super emotional because I know how much I wanted this and how much I put into it and how much it means to me. So just thinking back to that first day when I was unsure of myself, and now I feel like
I have more confidence. I've met some really great people, the faculty here, the experiences that I had a chance to study abroad. I just feel like not only has it made me a stronger person, but it has made me a more well-rounded public health professional and practitioner. And I really want to bring all of the experiences that I've learned here at Rutgers for these past 2 years into the work that I'm doing, and really just show people that public health matters and public health is essential, and health is a human right. That is something that I will forever, live by. Health is a human right, and everyone should have access to quality healthcare. It's important. The work we do is important, and I'm just so happy that that person on the first day stuck through, and here I am today.
Hey, future self, in like 2 years, I just wanted to say I hope you accomplish everything that you wanted for your 2 years here in the program. I don't have any place that I want to really be in, but I just hope I end up finding something that I really love to do, and it's to help people. Wish you the best of luck for everything. Now that you're leaving Rutgers, time here, it was just amazing. I met amazing people, I made a lot of friends, and I was able to make connections, and I feel like that's what Rutgers is all about. I'm definitely proud of myself and just everything that I've done in the last 2 years. Want to say good job for doing everything that you did, going out of your way, talking to people, and just, at the end of the day, doing what you love, which is helping people. You have a job, and I just want to give a shout out to mom and dad and my family and everyone that supported me on this journey. And, everyone here at Rutgers, coming here for my master's, I definitely did the right choice for that. Way to go. And yeah, I just hope everything works out for the best and positive things to come.
Ahana, if you are on graduation day, I'm so happy for you. Congratulations. I was not very sure if you would get to this day when I signed up for it, but if you're on the other side and you're watching this, then we did it. I hope you clap really loud for yourself. I hope your smile is bigger than this one because you finally figured out what you wanted to do out there in the real world, and I hope you're really happy with the answer, and our journey together for 2 years was worth it. And besides that, I hope that you still have the charisma to just jump into whatever you want, like how you did when we started this journey together. I hope you're ready to face the big world up there. Whatever it is, we got it together. We'll get it done. My initial reaction to the video was very overwhelming. I ended up having tears, and just looking at myself 2 years ago, I felt how lost that girl was 2 years ago, and how we really did jump in the dark, and we were trying to hope to get through this to something better on the other side. 2 years later, being here and watching that again, I couldn't be more proud of myself, because it's not just learning about what they teach you in school, it's about learning life and navigating through that with so much courage and confidence. And looking back, that just made me really proud of the 2-year journey that I've had. And the girl who was there at the orientation saying all those things, she would be so proud of who I am here sitting in front of you. I was wanting to get something really good out of my journey, and I did. Our journey continues to dental school in 2 weeks. And that's the most proudest thing for me, to have my dream come true and to have that come true while I was on this journey, because it just makes it that much more ecstatic and amazing, and I'm out of words right now. Very happy that I came to Rutgers, very happy that I walked into the unknown with great confidence, and moving on, I just know that I'm going to keep that courage and confidence with me, because if I could do it back then, I could just do it 10 times better. I'm so excited for what comes next.
I think I would hope to feel accomplished. I know that we've gone through a lot, and I imagine you're probably still going through a lot in that moment in time, but I hope that hasn't made you hard in a sense. You're still able to feel all the feels and still feel accomplished in what you've done and what you've accomplished over the last 2 years, not just within the classroom setting, but also outside with the thesis that you have planned, and just kind of understanding that your importance isn't just tied to a lab bench. You can have an impact not just with rodents, but with humans as well, and understanding their difficulties in navigating healthcare, just as you have on a larger basis. I don't remember what I said until this moment, obviously. Almost 2 years ago, the world was in a very difficult place. I was in a very difficult place. And unfortunately, I can't say that, the state of the world has bettered itself. And so I can't necessarily derive hope from that. But what does give me a lot of hope is today, seeing all my friends dressed in their cap and gown, getting ready to receive their doctorate, their MPH, their MS, whatever the case may be. And be ready to kind of go out into that world with its many problems and actually try to help it. And seeing the professors who have supported us along that way and within the classroom setting or even outside, like with my advisor, Dr. Bushnell, for the thesis that I mentioned in that video, which is funny that I even mentioned it. Now you're kind of transitioning from this point as a student to somebody who can contribute on a more regular basis when you're not, worried about exams and such. And so I think that's something that's very powerful and does give me a lot of hope. And I very much look forward to see what all my friends end up doing.
Hey girl, you finally made it. I hope all of your checklists are clear. I hope you decided which program or which route you want to take after this. Congratulations, you freaking made it. It was a long road. Hope you're enjoying your life and just not stressing about everyone else's lives. I hope you're going on vacation soon.
I hope that you figured everything out to an extent, like not to stress yourself out, to like go with the flow and like let things fall in its places. And I hope that you're doing good things and pursuing your dream, medical school soon.
It's coming.
So yeah, I hope that you figured out a program or at least like found a big time job in between, or you're just happy,
Right. Are you happy?
Oh yeah, I'm finished.
Okay, good.
Oh my God. We made it this far. I'm so excited that we got here.
Congratulations to us both. Reflecting on that video, I wouldn't say I'm as stressed as before. I still just haven't cleared all of my checklists, but we're getting there. Everyone has played a special piece into this puzzle that is made me into the woman I am today, and all the resources that are allocated towards making sure we have what we need for the future, whether it's career, whether it's research, whether it's academic, everything has been provided for us. They've given us the blueprint per se, so now we just have to go out into the real world.
Overall, I've had a lot of learning experiences, especially with like the study abroad programs that have connected me to other nonprofit organizations. Looking to apply to med schools now. I'm working on my big girl job. I feel like I'm shopping. Things definitely did fall into its place. That's for sure. It was like a big puzzle, and the pieces were all scattered and missing, but we're slowly finding it to put it together.
We're almost there. And yes, whatever the future holds, that's in God's hands. Today, we're gonna worry about walking across that stage and hopefully making an impact in the future.
Yes, public health maxing.
Yes, it's
I hope when I graduate that I feel very confident in myself and the work that I want to pursue. Hopefully it's something in maternal health, because that's what I want to do. But if, something else calls to me as I study, that'd be cool too. I'm just really proud of you, honestly.
This is so cute. Honestly, it was really weird seeing like old me, because it doesn't look that much younger, but still, I don't know, it just looks younger. Rutgers was just a community that I really owe a lot to. They were just there for me whenever I really needed it. I just always wanted to do maternal health, and I really do hope someone answered my call to that. I just learned how to be a leader and how to take charge, but not in a really mean way, but in like an assertive way, and have people really be interested in what I say and understand that I am here to help.
At the end of this program, I am hoping that I will be working actively in public health, whether it's from the clinical setting or from the teaching setting. I'm hoping that it's more so towards teaching, simply because, I want to be able to look at people that look like me, that have been through situations like how I've been, and then they're able to understand that I'm coming from a place where I really want to help. It's not that I'm trying to oppress them by making them feel bad about their situation as far as their health and their behaviors are concerned, but looking at it as a way to be a form of inspiration for them to say, you know what, I can do better, I can be better. So I'm hoping that that's what I get to do with public health.
Wow. I really am at the position of where now I can implement all of this information that I learned, all of the interactions that I have with my peers, my professors, even with like my capstone and my APE. I was able to like network and interact with so many different people in different ways. I got to be able to train people to implement strategies, talk about health advocacy, how important it is with mental health, especially with minorities. And it's just like seeing that and being like, oh my gosh, I actually did do a lot of that while I was doing my academic coursework. And, sometimes you don't feel
as if you're to be in the spaces that you're in. I reflect with a lot of my peers at that, where, you know, sometimes you go through that imposter syndrome and think that you shouldn't be where you are. And then you see stuff like that, or you interact with people and then you don't realize how much of an impact you are for them. And then you're like, well, yes, I really am doing what I'm supposed to do. You know, I never thought that public health would have meant so much to me. I didn't realize that even from my own life, working in public health, studying public health, that, you know, it changed my life too. I got to change a lot of health behaviors myself with public health, and things have progressed in such a wonderful way for me. I'm so grateful. I'm so grateful. My experience at Rutgers has helped me academically, professionally, and personally. For people who are like, you know, on that line of if I should really go and do my master's in public health, I'm like, do it scared. You know, you don't know what it's going to result in, but then you don't want to regret not doing it, because then you're like, what if I should have, I could have, but I didn't. But I'm so glad I did. I'm so glad. I'm so overwhelmed, but at the same time, it's like overwhelmed with wonderful feelings, passionate feelings. And, you know, right now it's a hard time for public health, but, you know, this is the time where we have to understand how to be fluid with it, and how public health may not look in its traditional way, but we just have to be able to be, you know, proactive and flexible, and be able to still help the communities that we're going to serve, because they still need help despite whatever else is going on in the world. So I'm just happy.